CHIP training for the Healthcare Coordination Notice. In order to get to the Healthcare Coordination Notice, you must first log into CHIP. We will be using a fictitious client, Clark Kent. Click on the Consumer Chart link. You can put in the client case number to access the chart or type in the consumer first and last name and click Search. Click on the Consumer Chart link to access the medical record. Click on the Charts document link. In the left-hand column, scroll down until you have located the Healthcare Coordination Notice. Click on it. At this point, you can view previous Healthcare Coordination Notices or add a new notice. Click on the Add Healthcare Coordination Notice link. The first thing you need to do is add the date that the notice is being completed. You can click on the Use Current Date link to fill in the current date. In the To field, under the section titled Primary Care Physician, you can fill in the name, address, phone number, and fax number of the person or place or business that you will be coordinating care with. Also, if this is a person or a place that you have coordinated care with recently, the information should be pre-filled. However, you can select the Lookup button to find the person or place, and the information will pre-fill in the various boxes. Please ensure that the pre-filled information is accurate. If you are faxing the Healthcare Coordination Notice, please ensure the small box is checked. Also, make sure that the date is included in the larger box underneath. Please follow the same process as above when the Healthcare Coordination Notice is being mailed and/or hand-delivered. In the Qualified Health Plan field, under the section titled QHP, the QHP information should already present itself. If pre-filled, please make sure that the information is accurate. If not pre-filled, please use the Lookup button to include the QHP information. Next, select the appropriate method of communication box along with the date and select Mailed, Faxed, or Hand-Delivered. In the From field, under the section titled Program, the program information should already present itself. In the event that it doesn't, please enter the program code or use the Lookup button to select the correct program that is coordinating care. Next, please ensure that the following boxes are filled in with the information necessary to coordinate care. For example, under Types of Service, in the Specialty Support/Services box, staff would include all the services and supports the client is presently receiving, such as targeted case management, medication clinic, outpatient, either mental health or SUD, and/or occupational therapist or psychologist. In the box titled Hospitalization, staff would include detail regarding any recent psychiatric hospitalizations, including the date and location. In the box titled Level of Care Change, staff would include any recent level of care changes. As an example, a client was an ACTP but is now transitioning to case management. In the box titled Medication, staff would include all client current medications. In the box titled Discharge from Services, staff would include the date the client was discharged from the specific program. Next, in the box titled Other Significant Change, staff may include any significant medical or physical condition, safety issue, housing, etc. that may impact client care. Next, under the section titled Documents Enclosed, staff will select the appropriate box for healthcare screening, med change, and/or other. Under the section titled Authorization Given for Release of, staff should select only those boxes that apply. Please refer to the section above under Types of Services as a reference. We are finally at the end. This is the time that staff would review this document to ensure that all information is accurate prior to signing off. You have now completed the Healthcare Coordination Notice.